Hello everyone, welcome to Sam Science View channel. In today's video, we are going to listen to a science fact all about iron deficiency in our body. Before going into the video, please watch this entire video, and if you have any science related queries, you can comment about it and get it rectified through this channel. Now let's get into the video. If you are struggling with any unexplained fatigue or weakness and looking for the root cause, you may find yourself wondering if low iron could be the culprit. Iron is an essential mineral that helps your body carry out a number of important processes. One of the most essential roles iron plays is helping make and maintain healthy blood. Iron is needed to form hemoglobin, a protein in red blood cells responsible for carrying oxygen throughout the body. This is an important job, so it's easy to see how being deficient in iron can come with consequences. Iron is an important mineral that is involved in various bodily functions, including the transport of oxygen in the blood. This is essential for providing energy for daily life. It's a good source of iron, which may include red meat, offal, and iron fortified breakfast cereals. Iron is lost from the body through sweat, shedding, intestinal cells, and blood loss. About one third of the world's population is iron deficient. Menstruating women are at a greater risk than men and postmenopausal women of iron deficiency. It is thought that up to 5% of the Australian population has iron deficiency anemia. Some of the many roles of iron in the body include oxygen transport. Red blood cells contain hemoglobin, a complex protein that carries oxygen from the lungs to the rest of the body. This hemoglobin is partly made from iron and accounts for about two-thirds of the body's iron. Second is myoglobin, a special protein that helps store oxygen in muscle cells. This myoglobin contains iron and is responsible for the red color of muscles. Third is enzymes. Many enzymes throughout the body contain iron, including those involved in energy production. Enzymes are catalysts which increase the rate of a chemical reaction that drive many cell functions. And lastly, immune system, its proper functioning relies in part on sufficient iron. The immune system helps us to fight against infection. The average person needs to absorb just a small amount of iron each day to stay healthy, which is around 1 milligram for adult males and 1.5 milligram for menstruating females. To achieve this, however, we need to consume several times that amount. This is because our bodies absorb only a fraction of iron contained in the foods we eat. There is an amount of dietary iron required to meet the needs of most of the population. This amount is different for different age groups and life stages. So, for babies less than 6 months, only zero point 0.2 milligram per day is needed, and they can give it through the breastfeed and breastfeed milk and through that alone. And for infants aged 7 to 12 months, it's 11 milligram, and for girls and boys aged 1 to 3, it's around 9. For age 4 to 8, it's 10. For age 9 to 13, it's 8. For boys aged 14 to 18, it's 11. For girls, it is 15. For women aged 19 to 50, it's 18. Pregnant woman needs 27. Breastfeeding women over age 18 need 9. And for women aged 14 to 18 for breastfeeding need 10. Women aged 51 and over need 8, and men aged 19 and over need 8. So, there are two types of iron found in our diets. One is heme iron, which is found in animal tissue such as beef, lamb, kangaroo, chicken, and fish. Offal products such as liver and kidney are particularly rich in heme iron. However, pregnant women should avoid eating too much offal as it contains large amounts of vitamin A, which can cause birth defects. This form of iron is most easily absorbed by the body. And the second type is non heme iron, which is found in animal tissue, animal based products, and plant foods such as dried beans and lentils. Good vegetarian sources of non heme iron include iron fortified breakfast cereals, whole grains, and legumes like beans and lentils. If you are a vegetarian and have no animal tissue in your diet, you may need almost twice as much dietary iron each day as non vegetarians. Plant based sources of iron include dark green leafy vegetables such as broccoli, raisins, nuts, prawns, dried apricots, seeds, dried beans and peas, and iron fortified cereals, breads, and pastas. How much iron you absorb from your diet depends on how much iron your body is storing. The healthy body absorbs around 18% of the available iron from a typical Western diet, which includes animal foods, and about 10% from a vegetarian diet. However, you may be absorbing much less than that even if your diet includes iron rich foods. The most significant influence on iron absorption is the amount of iron already stored in your body. The body stores iron in various places, including the liver. If your stores are high, your body absorbs less iron from the foods you eat. Conversely, low iron stores increase your ability to absorb iron. Certain foods and drinks affect how much iron your body absorbs. To boost iron absorption, you must consume vitamin C, which is found in fruits and vegetables, include animal protein heme with plant that is non-heme sources of iron such as meat with beans, for example beef and kidney beans in a chili corn can. Cook plant sources of iron such as vegetables. In most cases, cooking increases the amount of available non-heme iron in vegetables. For example, the body absorbs 6% of the iron from raw broccoli compared to 30% from cooked broccoli. Foods and drinks that reduce your body's ability to absorb iron are soy proteins, which can reduce absorption from plant sources. Tea, coffee, and wine contain tannins that reduce iron absorption by binding to the iron and carrying it out of the body. Phytates and fibers found in whole grains such as bran can reduce the absorption of iron and other minerals. Inadequate vitamin A in your diet would lead to iron deficiency because vitamin A helps to release stored iron. Calcium and phosphorus reduce the absorption of plant sourced non heme iron. 1 in 8 people aged 2 years and over does not consume enough iron on average to meet their needs. If you do not have enough iron in your body, it is called being iron deficient. This can make you feel tired and lower your immunity. Including iron rich foods in your diet can help. People who are at an increased risk of iron deficiency include babies given cows or other milk instead of breastfeed or infant formula, toddlers, particularly if they drink too much cow's milk, teenage girls, menstruating women, especially those who have heavy periods, women using an IUD because they generally have heavier periods, pregnant women, breastfeeding women, people with poor diets such as people who are alcohol dependent, people who follow fat diets, or people with eating disorders. people who follow a vegetarian or vegan diet, Aboriginal Australians, athletes in training, people with intestinal worms, regular blood donors, people with conditions that predispose them to bleeding, such as gum disease or stomach ulcers, polyps, or cancers of the bowel, people with chronic diseases such as cancer, autoimmune diseases, heart failure, or renal kidney disease, people taking aspirin as a regular medication, people who have a lower than normal ability to absorb or use iron, such as someone with celiac disease. Most of your body's iron is in the hemoglobin of your red blood cells, which carry oxygen to your body. Extra iron is stored in your liver and is used by our body when our dietary intake is too low. If you don't have enough iron in your diet, your body's iron stores get lower over time. This can cause iron depletion, which is when hemoglobin levels are normal, but your body only has a small amount of stored iron which will soon run out. This stage usually has no obvious symptoms. Iron deficiency is the state when your stored and blood-borne iron levels are low and your hemoglobin levels have dropped below normal. You may experience some symptoms including tiredness. Iron deficiency anemia is the state when your hemoglobin levels are so low that your blood is unable to deliver enough oxygen to your cells. Symptoms include looking very pale, breathlessness, dizziness, and fatigue. People with iron deficiency anemia may also have reduced immune function, so they are more vulnerable to infection. In children, iron deficiency anemia can affect growth and brain development. The signs and symptoms of iron deficiency anemia in children may include behavioral problems, repeat infections, loss of appetite, lethargy, breathlessness, increased sweating, strange food cravings, pica like eating dirt, failure to grow at the expected rate. In adults, some of the common causes of iron deficiency include not getting enough iron in your diet, also known as inadequate dietary intake. There are many reasons why someone's dietary intake of iron could be too low, for example, due to a poorly balanced vegetarian diet, chronic fat dieting, or having limited access to a wide range of fresh foods. Second is a blood loss. Iron deficiency easily occurs in situations of chronic, ongoing blood loss. Common causes include heavy menstrual periods, regular blood donation, regular nosebleeds, other chronic conditions that involve bleeding, such as peptic ulcers, polyps, or cancers in the large intestine, and certain medications, particularly aspirin. Third is an increased need for iron. If you are pregnant or breastfeeding, your body needs more iron. If this increased need isn't met, iron deficiency can quickly occur. Fourth is exercise. Athletes are prone to iron deficiency because regular exercise increases the body's need for iron in several ways. For example, heart training promotes red blood cell production, which requires iron, and iron is lost through sweating. Fifth is inability to absorb iron. Healthy adults absorb about 10 to 15% of dietary iron, but some people's bodies are unable to absorb or use iron from food. Major risk factors for the development of iron deficiency in children include prematurity and low birth weight, exclusive breastfeeding beyond 6 months, not introducing solids, high intake of cow's milk in young children less than 2 years of age, low or no meat intake, vegetarian and vegan eating, poor diet in the second year of life, possible gastrointestinal diseases, and lead poisoning. Babies, children, and teenagers undergo rapid growth spurts which increase their need for iron. The main causes of iron deficiency in children by age group include babies less than 6 month olds, newborns receive their iron stores in the uterus, that is womb, which means the mother's diet during pregnancy is very important. Low birth weight or premature babies are at increased risk of iron deficiency and will need iron supplements under medical supervision only. You have to visit your doctor for further advice. Babies aged 6 months to 1 year or a baby's iron stores run low in the second half of their first year. Iron deficiency can result if their diet doesn't include enough iron rich solid food. At around 6 months, 2 serving a day of plain iron fortified infant cereal mixed with breastfeed or infant formula can start to be given. Plain pureed meats can soon be offered with other solids. Once your baby is used to the cereal, late introduction of solids into the baby's diet is a common cause of iron deficiency in this age group. Next is children aged 1 to 5 years. Breast milk contains a small amount of iron, but prolonged breastfeeding can lead to iron deficiency, especially if breast milk replaces solid foods in the diet. Low iron milks such as cow's milk, goat's milk, and soy milk should not be given until 12 months of age. Children who drink milk in preference to eating solid foods are in danger of iron deficiency. Next is teenagers. Adolescent girls are at risk because of a number of factors, including growth spurts at puberty, iron loss through periods, that is menstruation, and risk of undernutrition due to fad dieting that restricts eating. In general, gastrointestinal disorders such as celiac disease are a rare but possible cause of anemia in children. Preventing iron deficiency in babies are to be recommended. Some suggestions are have an iron rich diet during pregnancy. Red meat is the best source. Tests to check for anemia should be conducted during pregnancy. If your doctor prescribes iron supplements, take them only according to instructions. Breastfeed your baby or choose iron fortified infant formulas. Don't give your baby cow's milk or other fluids that may displace iron rich solid foods before 12 months of age. Don't delay the introduction of solid foods. Start giving your baby pureed foods when they are around 6 months of age. Fortified baby cereal made with iron fortified infant formula or breast milk is generally the first food to offer. This is because of its iron content but also because its texture is easy to change. Introduce some lumpy foods or mashed foods at around 7 months. To prevent iron deficiency in toddlers and preschoolers, include lean red meat in their diet 3 to 4 times a week. Offer meat alternatives such as dried beans, lentils, chickpeas, canned beans, poultry, fish, eggs, and small amounts of nuts and nut pastes. These are important sources of iron in your child's daily diet. If your family follows a vegan or vegetarian diet, you may need to seek advice from a dietitian to ensure you are meeting all your child's dietary needs. Include vitamin C in your diet as this helps the body to absorb more iron. Make sure your child has plenty of foods rich in vitamin C like oranges, lemons, mandarins, berries, kiwi fruit, tomatoes, cabbage, capsicum, and broccoli. Encourage solid foods at meal times and take care that toddlers are not filling up on drinks between meals. Remember that chronic diarrhea can deplete your child's iron stores, while intestinal parasites such as worms can cause iron deficiency. Go to your doctor for prompt diagnosis and treatment. Fussy eaters may be at risk due to poor intake or lack of variety in the foods they eat. Seek advice from your dietitian, local doctor, or child health nurse on how to manage a fussy eater. To prevent iron deficiency in teenagers, talk to your child about the importance of iron. Help them become informed enough to make their own responsibility food choices. Encourage iron rich foods and meals such as iron fortified breakfast cereals and breads, and serve meat, poultry, and fish with the evening meal. Offer good sources of non-heme iron such as dried beans, lentils, peas, broccoli, spinach, beans, fortified cereals, breads, and whole grains if your child wants to avoid red meat or become vegetarian. Vitamin C rich foods should also be encouraged, such as fruits or vegetables with meals. Encourage only moderate amounts of tea and coffee as these can interfere with iron absorption. Make an appointment with your doctor if you think you may be iron deficient. Diagnosis aims to exclude other illnesses that can have similar symptoms such as celiac disease. Diagnosis methods include physical examination, medical history, and blood test. Treatment for iron deficiency depends on your iron status and the underlying cause. If you have iron depletion, your doctor will give you information about including iron rich foods in your diet. You will have another blood test in around 6 months to check that your iron level has improved. If you have iron deficiency, your doctor will give you dietary advice and closely monitor your diet. They will encourage you to have iron rich foods and discourage you from having foods and drinks such as bran, tea, and coffee that can interfere with iron absorption with meals. They will regularly review your iron status and may prescribe supplements. If you have iron deficiency anemia, your doctor will prescribe iron supplements. It may take 6 months to 1 year for your body to restock its iron stores. Your iron levels will be regularly reviewed with blood tests. If you have an underlying problem that is causing your iron deficiency, it is very important that the cause is investigated. If it is a medical cause, it is important that it be treated appropriately. Don't just self diagnose iron deficiency since iron supplements are available without prescription. It can be tempting to self diagnose, but this is not recommended because having too much iron in the body can be toxic and even fatal. Fatigue, paleness, dizziness, and breathlessness are symptoms of many other health conditions, not just iron deficiency anemia. Some of these other conditions are serious. Incorrectly self diagnosing and self medicating can be dangerous and can waste valuable time in getting the treatment you need. Getting the right treatment in the early stages of a disease offers a greater chance of recovery. So, always visit your doctor if you think you would be iron deficient. Iron supplements won't help the symptoms if iron deficiency anemia isn't the problem, and you could be spending money on tablets you or your child don't need. Taking an iron supplement when you don't need it can interfere with your body's absorption of other minerals, including zinc and copper. About 1 in 300 people have hemochromatosis, which is an inherited condition that prompts the body to absorb more iron than usual. Excess iron damages the body's tissues and increases the risk of cancers and heart disease. People with hemochromatosis need to limit how much iron they consume. Do not self diagnose or give your child over the counter iron supplements because an overdose of iron can cause death. In infants and young children, 20 mg per day is the safe upper limit. Most iron supplements contain around 100 mg per tablet. It is important to keep iron supplements tightly capped and away from children's reach, as iron tablets are often mistaken as lollies by children. If you suspect an iron overdose, call to your doctor and immediately go to a local hospital emergency department. If you have been advised to take iron supplements, keep in mind that the most common side effects of iron supplements is dark colored or black stools. So don't be alarmed by this change to your bowel habits. Other common side effects include nausea, vomiting, constipation, and diarrhea. See your doctor for advice, but generally speaking, treatment involves lowering the recommended dose for a short time to give the body time to adjust. Iron supplements should be taken on an empty stomach if possible. Supplements should be taken exactly as advised by your doctor. The human body isn't very good at excreting iron, and you would poison yourself if you take more than the recommended dose. So, in summary, iron is an important dietary mineral that is involved in various bodily functions, including the transport of oxygen in the body. Dietary iron is found in animal and plant foods, and deficiency can be treated by adding iron rich foods to your diet. Iron deficiency is when your body's iron stores are too low. Common causes include not getting enough iron in your diet, chronic blood loss, pregnancy, and vigorous exercise. Some foods and drinks affect how much iron your body absorbs. Most people develop iron deficiency anemia because they are losing blood or not absorbing it from their diet. If you think you have these issues, ask your doctor or healthcare provider what you can do to avoid iron deficiency anemia. So, if you have come across these problems, don't self medicate yourself. Go to a physician or a doctor and consult them and get a blood test and know about your iron level in your body and get it rectified. So, that's it for today's video. I hope so you got some science facts about all about the iron deficiency in our body. And if you have any science related queries, you can ask it and get it rectified through this channel. We will meet in the next Science Fact Treasury series. Until then, it's goodbye from Sam. Take care.